I'm Dr. Esplin. I teach bioethics and health law at the College of Medicine, and I'm honored to be asked about how and why I advocate. With a background in law and an interest in psychiatric ethics, it's probably no surprise that I spend a lot of time thinking about justice and what that means in a criminal justice context, what that means in a bioethics context, and advocating specifically for access to services, mental health care, etc., for those who are detained or incarcerated. And part of how I advocate is in an everyday approach. I think that there's not one specific way we have to advocate in terms of bringing laws or bringing bills, or I think that's a very myopic way of thinking about what advocacy means, because to me it is in the everyday. It's in education, it's in exposing patient stories, it's in detention center reporting about conditions and bringing to light stories that may not be readily apparent. And so advocating to me means educating myself, educating others, having that dialogue, and really passing the mic to those who experience things directly. And that's hard when somebody is incarcerated or detained, to have them be able to tell their stories. But I think that that's what's really powerful. And when we think about the role of a medical professional, it might be easy to think that this patient population isn't as deserving of our empathy or of a high standard of care or duty of care. But I think that's really dangerous and a slippery slope to thinking that some people are more or less deserving than others. And we have a sacred obligation to alleviate suffering, and when we fall short of those obligations, we become an extension of law enforcement and punishment instead of therapy and the alleviation of suffering. And so I think that advocacy is in the everyday. It's in your normal day-to-day clothing. It's in educating yourself. And it's about really arguing. I love to argue, but arguing to clarify what our core values are, if we're meeting those, if punishment or if keeping people behind bars is actually doing what it is supposed to do. Are we really rehabbing somebody, or are we making them worse? And I think that those are powerful questions, and I think that's the core concept of advocacy. So, thank you.